my name is Robin, and today I'm going to walk you through how to withdraw a subcutaneous injection from a medication vial. This is a foundational skill that all nurses need to be comfortable with. The most common sub-Q injections given in a hospital setting are heparin and insulin. However, occasionally there will be hormones or vaccines given as well. Today, in our case, we'll use heparin as our example. Whenever you use heparin, make sure you know your hospital's policy. It is considered a high-risk medication, and some hospitals require you to withdraw the medication with a second verifier. So again, whenever you're administering heparin, ensure you know your hospital's policy and abide by their policy. For our case today, we're going to be administering 5,000 units of sub-Q heparin, and we're going to be administering this for DVT prophylaxis for a bed-bound patient. The first thing you need to do is you need to collect all your supplies. Our heparin. You'll need 2 needles. If you do have access to a blunt-tipped needle, go ahead and use one of those to withdraw the medication. If not, use a regular needle to withdraw the medication and a second different needle for the injection to ensure you have a sharp point that has not been dulled. You'll need a syringe. Typically, you'll want to pick a syringe that matches the volume you're going to be administering. In our case, we're going to be administering 0.5 milliliters. So I've chosen a 1 ml syringe. You'll also need alcohol wipes and some gloves, and of course a sharps container. Before you do anything, once you've gathered your supplies, ensure you have a clean workspace that's free of clutter. And then you'll need to wash your hands. The preferred method is to wash your hands with soap and water, but if you do not have access to soap and water, an alcohol-based hand sanitizer would be appropriate. So we're going to go ahead and we're going to sanitize our hands. Once your hands are all sanitized, you'll need to apply your gloves. Never withdraw a medication from a vial without using gloves. This is for your safety and also to prevent contamination in your patient's administration. The first most crucial step to withdrawing a medication is verifying your medication. This is not labeled, but we're going to go ahead and pretend. You'll need to verify the name of the medication, heparin, the concentration, and in this case we're going to use a 10,000 unit vial, units of heparin per 1 milliliter in this vial. The other thing you need to do is you need to verify the expiration and ensure the medication is not expired. You'll look at the liquid in the vial and you'll make sure it's not cloudy, there's no precipitates, or it doesn't look unusual or strange. If there's anything wrong with the vial or the cap has already been removed, do not use it. So you have your medication. I'm going to use a regular needle today because I do not have a blunt tip needle. So I'm going to go ahead and put the needle on my syringe. In order to open this vial, you gently push up with your thumb and you'll hear a little click or a snap when you push the plastic container off, and it pops right off like that. This top is considered a dust cover. It does not keep the rubber underneath sanitized, so you'll need to use your alcohol wipe to desanitize the lid of the vial. You'll press down firmly, agitating the rubber stopper for about 15 to 30 seconds. While I'm doing this, I'll remind everyone to allow it to dry for 10 seconds after agitating the top. The 10-second dry time is important to allow the alcohol to kill any microbes on the stopper. All right, that was 15 seconds. While that's drying, we'll take our syringe with the needle that we've put on the top, and we're going to draw back some air into the syringe. Typically, we'll draw back the amount of air that that equals the same volume of medication we're going to draw up. So 0.5. This air is very important to prevent a vacuum from being created inside of the bottle that prevents you from drawing the medication out of the vial. So the air is an important step in order to get the medication out. Go ahead and uncap your needle. It's been 10 seconds and the stopper is now dry. A lot of nurses will invert and put the needle in the rubber stopper like this. This increases your chances of a needle stick. So you'll want to keep the vial on a flat surface. And in the very center of the rubber stopper is a bullseye. You'll take the needle straight up and down and you'll just gently push it into the center of the vial in the middle of that bullseye. Once the needle is in the vial, you can then pick it up and invert it. Once it's inverted, go ahead and inject the air or push the air into the vial, again, preventing a vacuum that makes it so you cannot drop your medication. And then, as I just did, you'll pull the vial back on the needle until the needle is below the medication or inside the liquid medication. You would not, once the needle is in the medication, you'll then gently draw back until you have the amount of medication that you want. And in our case, it's 0.5. And then I like to draw back a little bit more to 0.6. And that way I can push any air that came out of the syringe back into the syringe. So there we go. Withdraw the vial gently from the top of the needle. And at this point, you'll want to recap your needle so that you can dispose of it to apply the second needle. So you're going to use a one-handed scoop technique. You'll take your syringe in one hand, you'll scoop up the top, and you'll settle it on the syringe. Then you'll take your other hand once it's on the needle, covering the needle, and you'll just secure it down. At this point, you can remove that needle and put it in the sharps container. Then you'll take your second needle, the one you plan to use for administration, and you'll put it on your syringe. A sub-Q injection is typically given with a 25 gauge or smaller needle, and you do not want the length of your needle to be more than a half inch. Sometimes they make even shorter and smaller needles, but in our case, we're going to use a 25 gauge half-inch needle. And now you're ready to administer your medication. I hope you enjoyed learning about the foundational skill of drawing up a medication from a medication vial. Thank you.